Hello everyone, welcome to PharmaGrid. Let's begin with question number 11. How many ATP molecules are produced during aerobic respiration of one molecule of glucose? The options are 24, 2, 3, 38. So here the correct answer is option D, that is 38. During aerobic respiration, complete oxidation of one glucose molecule produces 38 ATP molecules. Aerobic respiration involves glycolysis, link reaction, that is the oxidative decarboxylation of pyruvate, Krebs cycle and oxidative phosphorylation. Question number 12. Glycosidic linkage is an. The options are amide linkage, ether linkage, ester linkage, none of these. So here the correct answer is option B, that is ether linkage. That is the glycosidic linkage is an ether linkage. The glycosidic bonds are ether bonds formed between two monosaccharides by removal of a water molecule, that is the dehydration among two OH molecules. Ester bonds are formed by dehydration between a carboxylic group and an alcoholic group. Number 13. Dusting powder is sterilized by. The options are moist heat, dry heat, radiation, filtration. So here the correct answer is option B, that is dry heat sterilization. Dusting powders are of two types, that is medical dusting powders as well as surgical dusting powders. These medical dusting powders are used mainly for superficial skin conditions, whereas surgical dusting powders are used in body cavities and also on major wounds as a result of burns and umbilical cords of infants. Surgical dusting powders must be sterilized before their use, whereas medical dusting powders must be free from pathogenic microorganisms. Dusting powders are generally prepared by mixing two or more ingredients, one of which must be either starch, talc or kaolin as one of the ingredients of the formulation. Talc and kaolin are more commonly used because these are chemically inert. However, since such ingredients are readily contaminated with pathogenic bacteria, these must be sterilized by dry heat method. The temperature for dry heat method is 160 degrees Celsius for 2 hours before their use. Next question. The anticoagulant most commonly used to store blood in the blood banks is. The options are sodium nitrate, sodium fluoride, EDTA, acid citrate, dextrose. So here the correct answer is option D, that is acid citrate dextrose. The use of anticoagulants is very important in the blood bags that are stored in the blood banks, as they do not allow the stored blood to clot in the bag itself. If the coagulation of blood in the bag is not avoided, the blood will be clogged up and it cannot be used for any medical conditions. So this acid citrate dextrose is one of the most important anticoagulants that is employed for the stored blood. It does not allow the blood to coagulate. It inhibits the action of the binding of the calcium ions, which is one of the factors for coagulation. It is a commonly used anticoagulant in the process of plasmapheresis or removal of blood plasma or blood cells. Next question. Bond angle of atom in water molecule is. The options are 104.5 degree, 90 degree, 180 degree, 45 degree. Here the correct answer is option A, that is 104.5 degree. So here you can see the structure of water molecule. The electronic repulsions due to the presence of two lone pairs on the central oxygen atom reduce the HOH bond angle. So the bond angle in a molecule is the angle between two bonds that are connected to the same atom. Bond angles are an important factor in determining the shape and properties of a molecule. In water, the oxygen atom is bonded to two hydrogen atoms and has two lone pairs of electrons. The ideal bond angle in a symmetrical tetrahedral molecule is 109.5 degree, but it is due to the lone pair repulsive effect that the symmetry of the molecule gets disturbed, so the molecule adopts an asymmetric bend shape and the HOH bond angle decreases from the ideal 109.5 degree to 104.5 degree. With this question, we have completed today's recall session. Thank you for watching this video. Have a great day.